Dr. Peter Petropoulos from Potomac Medical Aesthetics wanted to talk to you today about the O shot, also called the orgasm shot. So if you or anybody that you know suffers from stress or urge urinary incontinence, which is something that affects over 1 in 20 women over the age of 20, accidentally urinating yourself when you sneeze or when you laugh, or you can't get to the bathroom in time, or other conditions such as painful intercourse, decreased lubrication with intercourse, loose vaginal tissue, decreased sexual desire, decreased ability to have orgasm both vaginally or through clitoral stimulation, or conditions such as lichen sclerosis, lichen planus, or pain from scars from childbirth. The O shot may be a great procedure for you. So you may have tried other therapies, including reducing water intake or going to the bathroom more frequently, but that's not always a realistic option. Kegel exercises or even medications designed to help with certain conditions that have many unwanted side effects. Hormone replacements, which may not always be options, especially in patients who have had cancer, or even psychological therapies, which usually don't work. So the way the O shot works is we're going to take your blood and isolate growth factors that are designed to grow both nerves and blood vessels and increase tissue in the vaginal area. So we do it using a very specific method designed by Dr. Runnels, who's the inventor of the O shot. And what we do is we put some topical anesthetic where we draw your blood, and then we apply topical anesthetic in the vaginal area at the site of the procedure. When we draw the blood, we take it to the centrifuge, spinning it down, isolating the plasma, which is the yellow portion of the blood, and that's what's called the PRP. We use that PRP and inject it into the critical areas that actually will cause the effects of the O shot to be very effective. And we use the same technique that Dr. Runnels uses, who again is the inventor. So the O shot is not a cure for every patient. So most patients, about 80 to 90%, will see an improvement in these conditions, but it's not a cure for everybody, especially in those who have issues like vaginal or bladder prolapse, general significant health issues like severe diabetes, or even some patients who have emotional issues. It won't work instantly. It usually takes about 2 to 3 weeks to work, and it lasts for about a year or two, and then the procedure may have to be repeated. And so it does effectively treat many women and helps them, and sometimes can be a good addition to existing therapies. But it doesn't work on every patient, but it may. And so what we should see is improvement in many of the issues that we talked about, especially in stress and urge urinary incontinence, sexual dysfunction such as arousal or decreased orgasm or lubrication, or painful intercourse. And we often see that most patients will have more frequent and intense orgasm. So if these are some conditions that you have thought about getting treatment for, have had unsuccessful treatment, please give us a call, 301-417-8372. We'll talk to you about the procedure, and we'd love to set up an appointment to have the procedure done if you're a proper candidate. Thank you very much.